I'm just going to kind of extend upon what Charlie was just talking about, because this is kind of, in my mind, the next step. If I think it's one step too far for a DARE, this is my go-to procedure most of the time. And I will say that over the years, and as Brian and I up here, apparently everyone was told yesterday, we're the old guys here. We're doing, or at least in our practice and at our place, we're doing more DAREs today than we ever have before. I have no disclosures relevant to this talk. I guess my only disclosure here is one of my former partners, Mike Cross, is in the background here, and I think some of these slides might actually be his. So current strategies for management of PJI, we talk about DARE, we talk about single stage revision, we talk about two-stage revision. So why do we consider single stage revision? We're going to talk about some of the perceived advantages and disadvantages. Then I'm going to talk a little bit about how we do it and to date, what the results are. And then I'm going to give a little plug for a prospective randomized trial that's going on that Brian can probably tell us a little bit more about in the discussion, because Ortho Carolina's really running that. So why do we consider single stage revision? What are the perceived advantages of this? Well, it's a single operation instead of two, as long as it's successful. There's no question it's a faster recovery for the patient. If you don't have to have a spacer intervening and a second stage, then the long-term functional results seem to be better. Again, all of these are based on if it's successful, it's a lower cost to the healthcare system. And honestly, when a patient comes in and they've got an infection and it's your patient, it's one of the worst days in the office. And it's really, really hard to tell a patient that they're going to need 2 operations spaced out by months and they're going to have a really crappy functional outcome